I'd say anywhere from $10,000 to like $15,000.
Whoa! Hi friends, welcome back to my channel. My name is Aina and I'm an oncology pharmacist. Today I wanted to react to clips of Ironmouse where she talks about her immunodeficient condition. I've seen clips of Ironmouse stream on YouTube and I know she has this immune system condition, but I don't know the full details of it. I wanted to make this video just so I can understand Ironmouse's condition a little bit more, so we can all know her a bit better and understand what she's actually going through. Alright, here we go. Let's start with the first clip.
I'm quite an interesting case, but I don't want to go into it because it's a lot and it's very personal and it's kind of rare. So, you know, we know you're rare. I'm medium rare, baby. Hey! It's considered a rare disease, but when you think about it, CVID is the most common to have of primary immune deficiency diseases.
CVID is common variable immunodeficiency. What that means is Ironmouse can't make her own antibodies, so she can't really fight off infections. Immunology is super confusing and I struggled really hard with this course when I was in school, but to simply put, healthy people have antibodies in our blood to help us fight off infections. Antibodies are also called Ig, which stands for immunoglobulin. There are 5 different categories of Ig: IgG, IgM, IgA, IgD, and IgE. Why these 5 letters? I have no idea. And the type of cell that produces these Igs are called B cells, and that's why Ironmouse was talking about her B cells not working well.
It's basically a decrease. Extreme decrease, that's my issue. An extreme decrease in IgG. Yeah, my issue is not that my immune system attacks me, it's that it doesn't know when to attack.
Right, so Ironmouse says her issue is not that her immune system attacks herself. That would be something called an autoimmune disease. It's that her immune system isn't working, so she can't fight off infections from the outside. But there are 5 different classes of IGs, right? So she said she has an extreme decrease in IgGs. So can't the other 4 categories help her fight off infections then? Well, it's because IgGs are the most common type of antibodies. It accounts for about 75% of all antibodies in your blood. So unfortunately, that means she's missing the majority of her antibodies to form a healthy, functional immune system.
Basically. Yeah, it doesn't defend. It's like my soldiers are all sleeping. And they're like, oh, there's a war going on? What? Either that or they're not there.
Yeah, that's actually a pretty good way to explain that.
And they don't want to fight, bros. But yeah, there's many things that make up your immune system. You got your white blood cells, you got your IgG, you got your IgA, you got your IgN.
Yeah, there you go. She's naming all of them.
You got T cells, you got memory B cells.
Gee, sounds like she knows a lot. And this is what I noticed in patients with chronic conditions. They actually kind of become the expert of their own condition. So she didn't talk about when she was diagnosed with this condition, but about 34% of patients are diagnosed before they even hit 10 years of age. She did say that she didn't want to get into the specifics of her condition because it's too personal, which I totally understand, so we're going to respect her privacy and keep it as is. But I hope that was a good overview of what the condition actually is.
I have a lung disease, okay? I have a lung disease called MAC, and there are multiple like types of strains that I have. Typically, like a person can carry like the bacteria of like MAC, and they'll be fine. But like a person with immune deficiency disease, the bacteria starts to get real bad, and it starts to eat away at you and do a lot of stupid shit. So you get a lot of like symptoms that are similar to like tuberculosis and stuff like that, like a lot of coughing up blood, and like weakness, and you feel like you're like suffocating, you know, that stuff, right? So when I first got it, I remember I used to have these horrible coughing fits where I would not stop coughing. And one time I coughed so hard that I cracked a rib. I fractured. Was it a fracture? I don't remember. It was something. I hurt myself. I was in the hospital for a long time.
Wow, okay. So almost everyone with CVID will get recurrent infections, and these infections can affect multiple organ systems. The most common being the respiratory tract and the gastrointestinal tract. The reason why these 2 systems are the most prone to infections is because they have openings that are exposed to the outside world. You've got your mouth, your nose, that's constantly eating, breathing, talking, every single day. So the chances that bacteria or viruses can enter through these systems are a lot higher.
For myself, I was in the hospital for a long time. I think I was there for like maybe 5 months. It wasn't a fun time.
Man, that's so rough, being hospitalized for 5 months. A lot of the times, a hospital stay can be lengthened by infections that we can't get rid of. I work in a cancer hospital, and a lot of our patients are on chemotherapy, and when they get infected, things are really scary and we take it very serious, and we want to make sure that we get rid of the infection before we let them go. So that's very similar to Ironmouse's condition, where she doesn't have a good immune system.
Yeah, it's bad. Unfortunately, there's different variants of it, and there's like no cure at all. You could just like treat it and calm it down, which is why I'm on medicine for like ever. And you can get like severe lung damage, and that damage never goes away. Like it's always there. So
Yeah, that sounds
like, I will
awful.
always have like a cough. I'll always have a cough. I'm on a lot of like meds right now, and a lot of like breathing meds that help. But I'll always have a cough.
Right, so MAC stands for Mycobacterium avium complex, and she mentions that she has a resistant strain, which means that it's hard to kill with the typical antibiotics we would give. But in general, the initial treatment for MAC is with at least 3 different antibiotics taken together. And the duration of treatment is pretty shocking. It's usually 15 to 18 months. I mean, most of us take antibiotics for anywhere between 5 to 7 days, right? And the antibiotics used to treat MAC are pretty hardcore stuff. They can give really bad side effects. You've got nausea, upset stomach, you've got decreased white blood cells, which for people who have CVID, of course that doesn't help. You can have impaired vision, you can have impaired hearing, you can have peripheral neuropathy, and the list goes on and on. And to the point where about 37% of patients actually discontinue treatment because they can't tolerate it. That's how bad this stuff is. Of course, that's just one of the potential issues patients can have. They can also get chronic gastrointestinal diseases. They can also get autoimmune diseases from this.
Remember when you used to hear the beeping of my machine all the time? Yeah, I have a noise gate now, so you can't hear him. The Geiger counter! I got a better oxygen concentrator, and it's not in my room. It's like outside of my room, so you can't hear it go. I think even now you can't hear it going up my nose. You can't hear it, right? Can you hear it now?
Yes, I can definitely hear the faint humming of the machine.
So much oxygen. Are you on that 24/7 life support? No, I'm not on life support.
Life support.
I'm not on life support. That's not what life
No,
support is. That's not what life support is. Life support is like when you're on a machine that helps you breathe and stuff. This is just oxygen going up my nose. I can breathe on my own.
So oxygen is prescribed for patients with hypoxemia. It's funny because when I used to work in the community, I would get really healthy patients coming in asking me to buy oxygen just so they can breathe in purer air. Actually, every time I see an oxygen tank, it somehow reminds me of Javier Bardem's character in No Country for Old Men. I know it's not even an oxygen tank that he uses. Let me know if you know what I'm talking about. Actually, a really fast and easy way to test a patient for hypoxemia is you can buy these little clips that just go on someone's finger, and that can detect the oxygen saturation in the blood. Usually we aim for a 92% or above oxygen saturation. If the hypoxemia is severe, you can actually tell by looking at someone's fingertips, and it actually turns a little bit blue.
I just need extra oxygen because my lungs don't work good. I'm fighting for my life out here. I'm on pure copium 24 hours a day, 7 days a week. You know what I mean? So without the oxygen, you wouldn't be able to live. Well, without oxygen, I wouldn't be able to talk to you guys. Oh no! Without oxygen, I can't live. No one would.
So I think she's talked about this a few times and even roasted the portrayal of people on oxygen in movies because they'd always be lugging around an oxygen tank with them. But she says that she has an oxygen concentrator, and that's because oxygen tanks don't last very long. One tank can last you maybe a few hours and they will just run out very fast.
I'm here with my little walker, like.
Oh my god, that's so cute. I like how she's so descriptive and makes the little creaky noises when someone walks with the walker.
Going to the bathroom. I'm gonna go to the bathroom. Yeah, like a little granny. I'm like a little granny with my little walker with the little tennis balls.
You wouldn't think CVID can affect someone's walking, but it does. Sometimes CVID patients can develop these painful inflamed joints. CVID patients can get rheumatoid arthritis, which is when their own immune system starts to attack their own cells, and you get these congregate of inflammation in the joints, and that's what we call rheumatoid arthritis. There's also septic arthritis, which is really scary. It's when bacteria actually goes into the joint space and causes inflammation there.
Imagine getting walker doc. Bro, I will fucking die if I get walker or wheelchair docs. I don't really use my wheelchair much anymore because my walking has improved quite a bit, but, you know, also I don't really go out.
It sounds like Ironmouse has struggled for a really long time with her mobility issues, but I'm really glad to hear that her walking has improved. Right. I guess the biggest question is, how do we actually treat this?
I took medicine because I wasn't feeling well today.
Need more plasma. Are you alright?
Yeah, plasma, I need it.
Need the plasma. Chat, donate. Donate plasma. Do it now.
I need it. Give it to me.
It's like Mr. Krabs. I need it.
I need it.
Bruh.
Now. It's hard out here for me.
Living in these streets.
In the mean streets.
How many bits is one plasma? How much does one bag of plasma cost?
Depends on how much and the brand.
Ironmouse is talking about different brands of plasma, which may sound weird because you think this is a product from another human, so why are they branded? The reason is they're not just giving raw plasma from one donor directly to a CVID patient. How it works is they take thousands and thousands of donors' plasma and they pool it all together, and it would go through multiple steps in the process to finally make a preparation called IVIG. IV meaning intravenous and IG meaning immunoglobulin, like we talked about in the beginning. So I looked it up and I actually didn't realize how many brands of IVIG there are. I guess the market is pretty big and there are lots of patients that need this. For example, in cancer, there are a certain type of lymphoma patients who also have immunosuppression, so they would definitely benefit from IVIG. Like another example, you can give ready-made IVIG to an unvaccinated person that's just been exposed to, let's say, measles. It's too late to vaccinate that person now, so the only option is to give them someone else's antibody in IVIG so they can fight off the measles infection.
But I'd say anywhere from $10,000 to like $15,000.
Whoa! Connor and I have the exact same reaction.
It's a lot of money.
Oh my god.
I have friends who work as pharmacists in the States, and sometimes we would just compare drug prices. And I think a box of Viagra there is about $400, but in Canada it's only about 80 bucks.
Bruh. Alright, chat, 10,000 bits for one plasma.
For one plasma.
But that's also like factoring in like your nurse has to come to administer.
Oh, that includes that cost as well.
That sounds great. It sounds like she has a home injection program where a nurse would come to the patient's home for injections.
Mine is like $12K because I have to pay for the nurse and stuff.
Yeah. Is it even an option to administer it yourself, or like that's like not even possible?
It's a blood product. You're really not allowed to do it.
You're like,
But
don't worry, I'll do it
sometimes-
raw. I'll do it.
Yeah, no, you can't. I'll tell you why. You can't. You can't put it in by yourself because there's always a risk of going into anaphylaxis.
Oh, so you need someone else to do it.
Yeah, or having like aseptic meningitis reaction.
Yeah.
So
Wow, I'm again really impressed by how well Ironmouse know all this stuff. So yeah, the reason why you can't give it to yourself is if you are someone that goes into anaphylaxis, the nurse would have to immediately administer hypersensitivity treatment. Usually that's epinephrine, but it depends on the patient's status as well. For example, if the patient has alarmingly low blood pressure, we would give you something to increase the blood pressure. Or if that patient has a full body rash, then we would give you something like an antihistamine to treat that as well.
I remember when I first got diagnosed, I was on like they put me on like Xanax and shit because I was always like really scared and panicking.
Xanax is the brand name for alprazolam, which is a benzodiazepine or benzos. And we usually give it for patients who have anxiety.
I mean, that makes sense.
Not anymore though. I think
Yeah.
I think I'm crazy.
No, I don't think she's crazy. She's just really brave, and she's probably gotten used to it. Unfortunately, for people who have chronic conditions, this becomes their new norm, and they forget about what it's like to live without their sickness in the first place.
For those of you that know and don't know, I have a port. And for those of you that don't know what a port is an implanted device inside of your chest that sits underneath the skin, and it's anchored usually to the collarbone.
It's usually somewhere right below your collarbone here.
And then it has a catheter in it, and it threads into your heart. So that when you get medication through that little device. Somebody puts a needle in the skin in your chest, and then the needle sits there and it's connected to a machine, and it brings your medicine into the catheter in your heart. So I have one of those on.
This is also called a chemo port because a lot of people who are on chemotherapy will get this port inserted as well. The purpose of this, like what Ironmouse said, is so that we can repeatedly give medication through IV to someone via this port instead of always having to find the vein on someone's arm and repeatedly poke them. And just think about how uncomfortable it is for you to get poked again and again. So the catheter actually threads directly into this big vein that returns blood to the heart. Medication would then directly go into the catheter and into the heart, and the heart pumps so that the medication is spread throughout the body. Wow, okay, I feel like after hearing her talk about her condition in such a conversational and open way, it really allowed me to understand her condition better and see things from a patient's perspective. And I feel like we really lack that sometimes as healthcare professionals. Alright, I hope you enjoyed this video as much as I enjoyed making it. Please let me know if I missed any important information down below. I did just a quick YouTube search and found the clips I thought were relevant. And if you have any other good ideas for future videos, please let me know as well. Don't forget to subscribe and give this video a thumbs up, and I'll see you in the next one. Bye!